Hi, everybody. As you may already know, Northeast Nigeria has suffered from years of conflict, causing widespread devastation and a significant IDP crisis that has led to a population increase in Maiduguri, the capital of Borno State. Sadly, this has worsened an existing water gap crisis in the city that has been a major problem since the 1990s. It is within this context that the humanitarian watch response in Maiduguri has focused largely on rehabilitating non-functional boreholes into solar-powered or hybrid systems to meet the water demands of IDPs and host communities. CRS bases for meeting water needs follow the same approach as other wash actors. As a water point was rehabilitated, a community water committee was formed with responsibility over fee collection, operation, and maintenance. However, we noticed that most committees were trapped in a cycle of water point breakages and unable to pay for repairs, which required continuous engagement from CRS to ensure the systems were up and running. We saw this as this dependence as unsustainable and cost ineffective. In 2016, while conducting technical assessment to inform CRS wash response, we discovered that an informal private water sector existed. This sector was composed of urban dwellers who drilled boreholes in their compounds and sold water to pushcart distributors, who sold jerrycans further to households. Despite this, new boreholes were still drilled or rehabilitated by government, NGOs, including CRS, even though populations still bought water from this informal private water sector. And we were surprised that no serious effort had been made by the WASH community to study or engage with it, especially at a time when market-based approaches were pushed by humanitarians. So in 2017, CRS decided to engage this informal water sector to test if it could provide a more sustainable solution to meet people's water needs than the traditional model implemented by CRS and the Maiduguri WASH community. In 2019, with funding from both USAID and CRS, we kickstarted the comparative study we present here today. And our research question was, is it more effective to directly support an existing informal private water sector than to rehabilitate existing boreholes and hand over management to a community managed water committee? Jenny, over to you.
So, in order to answer this research question, CRS began by first conducting a comprehensive assessment of the water situation in Maiduguri. This included three components: a market assessment, a technical assessment, and a social assessment. The market assessment analysed the water market system, identifying the key formal and informal actors involved in water sourcing, storage, sale, and consumption, and the constraints they face. The technical assessment looked at the condition and status of water sources operated by informal market actors, for example, in terms of their capacity, quality, and environmental risk. And the social assessment looked at the needs of the host and displaced populations, including where they source their water, their economic situation, their preferences, and their knowledge, attitudes, and practices. And based on the findings of this assessment, CRS then identified a number of pilot activities that would help address some of the constraints observed in the informal water sector. These activities aim to work with private borehole owners, pushcart sellers, and end users to improve access to quality water through this informal system. And these pilot activities were implemented from January 2020 to July 2021 and included things like training for borehole owners and pushcart sellers on safe water storage and handling, improving compound conditions and storage capacity of private borehole owners, including a cost share with CRS providing 90% and borehole owners contributing 10%, provision of jerry can cleaning equipment and kits for pushcart sellers to improve their operations, and also hygiene promotion with end users in the catchment areas to create specific demand, such as for chlorinated water, clean jerry cans, and good handling of water by pushcart sellers. And alongside these activities, CRS continued to implement its traditional approaches. At the same time, we developed a framework of costs and benefits that measured and compared rehabilitating non-functional boreholes and handing these over to communities versus supporting this informal private water sector. We then began to collect data from a sample of both private and community managed water points that CRS had supported with these activities to enable a comparison. And we collected 4 rounds of data on a quarterly basis from July 2021 to March 2022. We then analysed the results to enable a comparison of approaches. Just a note on some limitations, however, on the study. We did face a number of challenges that impacted our ability to collect regular quality data. This was mainly related to the COVID pandemic. This delayed our pilot implementation, as well as the startup of our monitoring activities, as well as the security situation. We were still operating in a protracted and volatile security environment that impacted the team's ability to get out to the field to collect data. So the research identified a number of key findings, but in the interest of time, we'll highlight just a couple here. So our first key finding was that the water output of community managed systems was significantly lower than that of private boreholes, even though CRS's investment in community managed systems was double its investment in private boreholes. So we found that the average amount of water output from private boreholes was around 86 cubic meters per month, compared with around 57 for community systems. However, when it came to our investment costs, we found that CRS spent on average around $6,700 to rehabilitate community managed boreholes, form committees, provide training, whereas we invested half this, about $3,000, to upgrade private boreholes and train their operators. Our second key finding was that there was no significant difference in water quality between private and community managed boreholes. A common concern with the largely unregulated informal private water sector is related to water quality. However, we found poor use of chlorination and water treatment across community managed and private boreholes, and a high reliance across all actors on NGOs, UN and government to provide chlorine, although on average, private borehole owners chlorinated more frequently than community managed boreholes. Our third key finding was that following project interventions, there was no significant difference between safety procedures and cleanliness of the private and community managed borehole compounds. We found that private borehole owners on average had cleaner compounds that were free from external contaminants compared with community managed water points, but the prevalence of safety procedures not followed was similar across all points. This highlights the importance of increasing awareness and promoting appropriate practices among all water supply actors. Our fourth key finding was that private borehole owners were investing significantly more in the maintenance and operations of their boreholes than the community water committees. Private borehole owners spent an average of 121,000 naira per month to run their boreholes, whereas communities spent just a tenth of that. We also found more effective cost recovery among private borehole owners. As a consequence of poor cost recovery among community managed systems, we found that when these systems broke down, they were out of action for longer, as they entirely relied on NGOs or the UN to fix breakdowns, whereas private boreholes quickly resolved breakdowns with their own resources, resulting in more reliable water supply. And despite private boreholes charging for water, we did find that the poorest community members are provided with water free of charge still, which reduced some concerns related to affordability and access. So overall, we found that the informal private sector plays a key role in the provision of water in Maiduguri, and that CRS interventions did contribute to improving the quality of service delivery, while also being more cost effective than investing solely in community managed structures. Therefore, we identified a number of opportunities or recommendations for actors to partner with informal private water sector for more sustainable water access in protracted urban crises, for actors to reassess their investment in community managed water structures as they often fail and encourage dependency, for actors also to invest more in private water providers and work to improve their regulation through government engagement, also to implement diverse interventions targeting different actors in the water system to ensure more sustainable outcomes, and also the importance of addressing water treatment and quality challenges, including access to chlorine for both private and community managed systems. Back to you, Rolando.
Thank you, Jenny. So to finalize, let us share some of the key conclusions. Today, a big part of water supply needs in Maiduguri are still met by the informal private water sector. One key aspect this experience has emphasized is that community managed water points may not always be the appropriate solution in urban settings. We'd therefore like to stress that to ensure effective water service provision in urban contexts, it is essential to first understand the urban water supply landscape. Doing it early on, especially during humanitarian contexts, can help identify informal water providers who can be engaged in service delivery. As we found out in our study, this could reduce costs and redirect resources towards other washed up sectors, but it can also lay the foundation for a formalization process with water authorities. Since the study started, for example, we have identified informal water sectors in Ethiopia, Kenya, and Somalia, and we're certain there are more to be discovered. So in case you encounter a similar one or decide to engage, we would like to share some thoughts that may help you. To ensure effective and sustainable outcome, it is crucial to design market support interventions that cater to the unique needs of providers. Additionally, having a range of interventions that target various stakeholders across the water chains, such as providers, transporters, end users, and governance structures, is vital. This approach will ensure that the interventions are more diverse and tailored to the specific needs of each group, leading to better outcomes in the longer term. Specific for private borehole owners, we recommend focusing on understanding their incentives, interests, and motivations to develop an appropriate business model. This could include exploring ways to increase investment in water treatment, reducing fuel costs by facilitating adoption of solar power systems, and better understanding affordability issues and facilitating the integration of private borehole owners into more regulated systems. For pushcart sellers and similar middlemen, our interventions should focus on enhancing the water handling practices and the quality of the services. This requires gaining a deeper comprehension of the business models and developing more personalized interventions to increase their earnings. Based on our research, it appears that involving the informal water sector can produce favorable results, even in a humanitarian context. Despite of the study, the potential of the informal private water sector remains largely unexplored, indicating that there is much more to learn. We therefore encourage WASH actors to continue engaging with formal water sectors wherever possible and whenever possible to increase our knowledge base of this. And please, here you can find our research and download it. Thank you very much. Thank you, Jenny. There you go.